Hey there everyone, welcome to my channel, Nurse ME here. I have picked some questions to put your nursing knowledge to the test. If you have any questions, do not hesitate to post them in the comments section and I will respond to you. I passed the NCLEX on the first try and I would love for each one of you to pass as well. Now before we jump into the questions, make sure you hit that subscribe button and give this video a like. And do not forget to drop a comment below sharing how many questions you got right.
Here's a set of 5 Next Generation NCLEX questions in various formats, complete with answers and explanations. Question 1. Extended multiple response. A patient with chronic kidney disease (CKD) is being discharged. Which instructions should the nurse include in the patient's discharge teaching? Select all that apply. Restrict dietary protein intake. Monitor blood pressure daily. Increase fluid intake to at least 3 liters per day. Limit potassium-rich foods. Avoid the use of over-the-counter NSAIDs. Take iron supplements as prescribed. Answer 1, 2, 4, 5, and 6. Explanation. Restrict dietary protein intake. Protein restriction helps reduce the buildup of urea and other waste products. Monitor blood pressure daily. CKD patients are at risk for hypertension, which can further damage the kidneys. Limit potassium-rich foods to prevent hyperkalemia, a common issue in CKD. Avoid the use of over-the-counter NSAIDs. NSAIDs can worsen kidney function. Take iron supplements as prescribed. CKD can cause anemia, and iron supplements may be necessary. Incorrect. Increase fluid intake to at least 3 liters per day. Fluid intake may need to be restricted in CKD to prevent fluid overload. Question 2. Close, fill in the blank. A patient with type 1 diabetes presents with symptoms of diabetic ketoacidosis, DKA. The nurse expects the patient to have a serum glucose level of blank milligram per deciliter. Answer 250 mg per deciliter. Explanation. DKA is characterized by hyperglycemia with serum glucose levels typically greater than 250 mg per deciliter. Question 3. Highlight. A patient with a history of asthma presents with shortness of breath and chest tightness. Which findings in the patient's history or symptoms indicate a severe asthma exacerbation? Highlight all that apply. Increased use of rescue inhaler. Peak flow less than 50% of personal best. Mild wheezing. Difficulty speaking in full sentences. Heart rate of 60 beats per minute. Answer. Increased use of rescue inhaler. Peak flow less than 50% of personal best. Difficulty speaking in full sentences. Explanation. Severe asthma exacerbation is indicated by increased use of rescue inhaler, a peak flow less than 50% of personal best, and difficulty speaking in full sentences. Incorrect. Mild wheezing. Mild wheezing is more typical of a less severe exacerbation. Heart rate of 60 bpm. Bradycardia is not a common sign of severe asthma exacerbation. Question 4. Matrix/grid. A nurse is reviewing lab results for a patient with suspected hepatic encephalopathy. Which lab values support this diagnosis? Select all that apply. Below is a table with lab values and expected findings in hepatic encephalopathy. Answer. Serum ammonia, elevated. Prothrombin time, PT prolonged. Explanation. Serum ammonia, elevated levels are indicative of hepatic encephalopathy. Prothrombin time, PT prolonged. PT indicates impaired liver function. Incorrect. Serum bilirubin, typically elevated, not decreased. Serum albumin, usually decreased in liver disease. Serum creatinine, not directly related to hepatic encephalopathy but may be elevated if renal function is impaired. Question 5. Trend case study. A 65-year-old patient is admitted with pneumonia and exhibits the following vital signs and lab results over 3 days. Interpret the trends and identify the priority action. Review the information in the table. What is the priority action? A. Increase fluid intake. B. Administer antipyretic medication. C. Initiate oxygen therapy. D. Obtain a follow-up chest X-ray. Answer. C. Initiate oxygen therapy. Explanation. The patient's oxygen saturation is progressively decreasing, indicating worsening hypoxia. Immediate initiation of oxygen therapy is the priority to improve oxygenation.
Thank you very much.